Good afternoon, everyone. My name is Felix Munger, and on behalf of the Canadian Municipal Network on Crime Prevention, I would like to welcome you to this webinar. Before we start the event, I'd like to first acknowledge that I'm joining you from the Waterloo region in Ontario, and I would like to acknowledge that this is the traditional lands of the Anishinaabe, Haudenosaunee, and the Neutrals people. I'm asking you to join me and acknowledge the traditional lands that you as attendees are joining us from and recognize the past and present generations, the elders, as well as the descendants and future generations of those Indigenous communities. To me, this acknowledgement means being committed to beginning the process of working to dismantle the ongoing legacies of settler colonialism, violence, and displacement through ongoing education and representation. So now it is my great pleasure to welcome Professor Alex Vitale. As you can see from the bio on our flyer, Dr. Vitale is Professor of Sociology and the coordinator of the Policing and Social Justice Project at Brooklyn College, as well as a visiting professor at London South Bank University. While Professor Vitale is located in the US, he's been consulting and presenting to groups across the globe, including Europe, as well as actually Montreal in Canada. Over the years, Dr. Vitale has spoken about the need to rethink policing tasks, including getting police out of mental health work and to bring in clinicians, the need to get police out of addiction business and to turn it over to public health. As a result, Dr. Vitale's research and publications can nicely inform our ongoing discussion on communities, policing, and funding for community-based crime prevention. Thank you, Dr. Vitale, for agreeing to join us today. Over to you, Dr. Vitale.
Thank you. Thank you, Felix. It is great to be here with everyone in Canada today. Sorry that I can't be up there visiting with everyone in person, but of course the technology in some ways allows more of us to get together in real time than would otherwise be possible. I want to talk a little bit about the context that in essence brings us together before we get into talking very specifically about the mental health situation. So what is this moment we're in, and what's the best way to understand it? It has been framed primarily as a racial justice issue. And I think that this is crucial, if not the entirety of the nature of the problem. One of the things that has been most striking about the protests this year has been the expression defund the police. The idea that there's a problem with policing is not new here in the US, and I think in many ways in Canada. There's been a period of about 6-8 years of sustained activism, mobilization, protest, and searching for answers around these questions. But what was really new about the events this summer was the emergence of this phrase, defund the police. And while this 3-word phrase that would fit on a cardboard protest sign is imperfect and fails to capture important parts of what the movement is talking about, it represents an important shift away from the idea that we're going to fix the problems of policing with some training, oversight, and policy changes, a set of what we sometimes refer to as procedural changes to policing. Things like implicit bias training, the implementation of body cameras, the change in use of force policies, de-escalation training, et cetera. And this reframing of the conversation around the term defunding the police was an attempt to signal a very concrete rejection of those proceduralist police reforms that are rooted in the idea that the problems of policing are ones of professionalization and implementation and proper procedure. The proceduralists believe that the way to fix policing is to implement reforms that restore public trust in the police so that the police can get back to doing their job of ensuring the public welfare. But the Defund the Police movement sees the problem in a different way. It actually wants to ask some questions about why we have turned so many responsibilities over to police in the first place, and asking more deeply whether or not policing is in fact the appropriate tool for addressing so many of the functions that have been turned over to them. And the reality is that even if we believe that policing can be fixed without addressing these larger questions, the research shows that there's very little reason to be confident about the effectiveness of these reforms. Let's just look for a second at the situation in Minneapolis. The officers involved in the death of George Floyd in Minneapolis, a city that had really embraced a huge amount of these procedural reforms that came out of the Obama administration. These officers had had implicit bias training, de-escalation training, mindfulness training, were wearing body cameras, were operating under a new use of force policy that required them to emphasize sanctity of life. We're operating under a new policy that required that officers who see their colleagues engage in misconduct must intervene. And we're operating under a new early warning system to identify officers with patterns of complaints and misconduct to try to either change their behavior or drive them out of the police force. So none of these reforms seem to have made any difference at all. I mean, they did all the reforms that are being asked for. And this has been the general experience across the US, is that these reforms are not working. And when we look more concretely at them, we begin to see why they couldn't possibly be working. In New York City, following the police killing of Eric Garner, the mayor and police commissioner said, we're going to do implicit bias training. We're going to do de-escalation training. We're going to do body cameras. It hasn't made any difference. And the city's own research has shown that these have not had any effect on officer behavior, especially implicit bias training, which assumes that the problems of race and policing are the result of individual level, unconscious, discretionary decision-making by officers. First of all, in the United States, we have a problem of explicit racism in American policing. We just fired here in New York a very high-ranking police officer who was in charge of the office that handles complaints of sexist and racist misconduct within the department. He was just fired because he was using a pseudonym to post racist rants on police chat boards. He was explicitly racist. And he was only discovered after a long-term investigation of trying to link these pseudonyms to specific officers. And we know that this is a pervasive problem across the US. But it's not the whole problem. Reducing this to individual officer bias is not an adequate explanation. There's a bigger problem, which is why we have turned the problems of primarily Black and brown communities over to police to solve. Whether it's in the guise of community policing or proactive policing or intelligence-led policing, at the root of this has to be in an analysis that says that policing is a tool of violence and coercion. Now, there may be situations where that's needed, where we have no other choice. But instead, what we've done is that as we have defunded a huge number of basic social services, the social safety net, and this is, of course, more profound in the United States than in Canada, but it is a problem there as well, that the burden of that defunding has fallen much more on some communities than others, the already most vulnerable marginal communities. And it has contributed directly to the production of mass homelessness, mass untreated mental health and substance abuse problems, mass participation in black markets of drugs and sex work and stolen goods. And then instead of actually addressing the underlying economic precarities that drive those social problems, we've turned those problems over to police to manage. And then when that policing invariably produces racial disparities and abuse, we are told, don't worry, we're going to fix it with some training. John Sewell, who was a one-time mayor of Toronto, who's now involved in police reform efforts, made a quote the other day that said, "Police culture eats training for lunch." That, in other words, it is the functional nature of policing and the mission that it's been given that determines the way policing is carried out. And no amount of training is going to change that. There's another well-known adage is that when a new officer finishes their time at the academy, joins a patrol partner, the first thing that partner says is, forget everything you learned at the academy. Now I'm going to teach you what we really do, which is we chase homeless people around the block. We drive kids off street corners. We, pull people over on a pretext and hopings of finding drugs, right? This is what real everyday policing looks like, regardless of what we try to teach them in the academy. So the demand of the defund movement is not just that police reform doesn't work, not just, and I'll give you this quote here from Sewell in the chat in an article that on this subject that came out quite recently. We need to closely interrogate the actual functions that have been turned over to policing. And the ways in which those functions, even when carried out in a procedurally proper manner, have a harmful burden on already vulnerable communities. A totally lawful, procedurally proper, unbiased drug arrest is still going to ruin some young person's life for no real good purpose. The criminalization of narcotics has been a 100% disaster. No lives have been saved. No public safety has been enhanced. Millions of people have been incarcerated because it served a set of political priorities, not because it was about really improving public health or public safety. And so the proper implementation of those fundamentally unjust laws is not going to fix the problem. We don't need to give narcotics units anti-bias training. We need to dismantle the criminalization of drugs. Well, the situation is very similar with the issue of police response to things like mental health crises, substance abuse crises, homelessness, which is taking up a growing proportion of police emergency response time. We know that 85, 90, 95% of police responses have nothing to do with violent crime. In fact, estimates are 40, 50% of what police do doesn't have anything to do with any crime. Noise complaints, litter problems, loose dogs, kids hanging out on the street corner, things that aren't actually illegal, but are perceived by someone calling for an emergency response as being somehow disorderly or out of place or a nuisance. And unfortunately, some of these extremely low-level calls are the source of some of the worst abuses of police power. In Toronto last year, I think actually now it would have been 2 years ago in 19, there were 30,000 police responses to someone having a mental health crisis. And a few of these actually involved the death of the person who was having a crisis. In the States, between 1.25% of all people killed by police are having a mental health crisis. It's one of the leading predictors of the likelihood of experiencing police violence is that the person is having a mental health crisis. Now, the initial response to this has not been to try to address the underlying mental health problems in our society. It's been to refine the police response through more training and actually giving police more resources. And this has taken two primary forms. This is the development of a co-response model and the development of a crisis intervention team, or CIT model, or sometimes referred to as the Memphis model. In the Memphis model, certain officers are given extensive training on the nature of mental health problems, on the availability of services, de-escalation techniques, etc. And in the co-response model, officers are partnered with either social service or clinical outreach workers who have experience in responding to mental health crises. And what the research shows is that the only time these new programs lead to improved outcomes is when the cities involved have also significantly expanded the availability of community-based mental health services. Which of course raises the question of, well, why don't we just increase the availability of community-based mental health services, since that seems to be the key variable that produces improvements. But we've largely been reluctant to do that. So what do we do instead? Well, the initial response in the states has been to produce a set of non-police crisis response teams. Modeled off of the CAHOOTS model in Oregon, which I'm sure some people by now are familiar with. It's been around for several years. It started as a community-based clinic initiative that became integrated into their emergency call response system. In 2019, 20% of all emergency crisis calls that came in the region that they cover were diverted to this CAHOOTS team. So they're diverting 20% of all emergency calls. And in over 99% of those calls, no police backup was requested. And in the few cases where it was, it rarely required that officers use any force, though it did in some cases. Estimates are that the region in which this operates, that they saved $8.5 million in direct policing costs and several million additional dollars in savings on emergency room visits. Because one of the primary responses that police engage in these cases is to take someone to an emergency room for a psychiatric emergency evaluation. But one of the things we know, right, is that emergency room visits are extremely expensive. It's one of the most expensive, like immediate, medical interventions, and doesn't tend to produce really great outcomes. People are held, stabilized, given maybe a referral for a follow-up appointment, some medication, and then they're back out on their own again. So a number of cities are currently looking at these crisis response teams, but this doesn't go far enough. This doesn't go far enough, because if the crisis response teams don't have access to alternative modalities of addressing the problem, they also will end up taking people to emergency rooms. So the best models are those that combine the creation of crisis response teams with improvements in community-based mental health services. So for instance, in LA County, which has had a huge problem with the jail population being overrun with folks having basically mental health problems, they have invested in community-based peer-to-peer mental health drop-in centers. So the idea here is that we need a community-based mental health intervention that isn't as costly and invasive and scary to people as going to an emergency room. And it turns out that this is a fairly successful intervention. It's been used in parts of Europe for decades, and a huge number of mental health conditions can be initially addressed in this way. And what they found is that as these programs are implemented, there are dramatic reductions in the need for locked psychiatric hospital beds because problems are being dealt with before they become a crisis. The burden of failing to do this is going to fall most heavily on the most vulnerable communities, those that can't afford private mental health services, that don't have robust family support networks. And so by failing to put these interventions in place, we are instead falling back on policing, which is relying on tools of threats and coercion to manage what are public health problems. And the same logic can be applied to problems around homelessness, substance abuse, sex work, and other problems that have been framed as policing problems, but really need different kinds of clinical interventions.